Start. Very good afternoon to all of you. This is Anuradha. I am from PMR department. So today's topic is all about occupational hazards. So as all of you know, what is occupational hazards? It is the hazards because of the occupations. Occupational hazards are the risks of illnesses or some accidents which is happening in the workplace. In other words, we call these as hazards that workers experience in their place of work. It's something like unpleasant that a person experiences or suffers as a result of doing their job. So we can classify this like physical, chemical, biological, radiological, ergonomical, behavioral. There are so many classifications of occupational hazards. So, but being a healthcare worker, so everyone should be knowing what is the occupational hazard. Okay. So in this session, we are going to see what is occupational hazards and department pertaining. Like each department is having their own hazards. So you should be knowing what are all the hazards in each department and what is the measures we are taking and how to prevent that so that we can have a safe environment around us. So as I told you, healthcare worker. Who is a healthcare worker? Any worker who works in the healthcare setup is called a healthcare worker. Among those, it includes doctors, nurses, pharmacists, laundry workers, housekeepers, everybody, including the ward assistants, lab technicians, radiology technicians, all comes under the healthcare category, worker category. So, before going to the session, we should be knowing what are all the common health hazards. So we should be knowing what are all the common health hazards. So adila varunathu nokkuvanengil blood-borne pathogens. Adayathu pathogens because of blood-borne. Adepole airborne pathogens. Pathogens because of the airborne conditions, like you may be passing, through air we come into contact with the pathogens. Adepole infectious diseases. Diseases, when you are coming in close contact with the people, you will get some infectious diseases. Adepole thanne ergonomic. What is ergonomic? Ergon means in Greek word, it's work. Nomic means laws. So nammal jolly cheyidathan karanam namakku endengilum, for example, oralu kore samayam irundu ore position la irundittu jolly cheyyuna aalanengil avarku back pain varan chance undu. Adepole neck pain varan chance undu. Adepole anybody who standing for a long time, sometimes they get heel pain, varicose veins. Adepolathe ee ergonomic related, work related injuries, we call it as ergonomics. Adindathu varudana ee repetitive strain injuries, nothing but for example typewriters, secretaries who always have a typing issues because of continuous typing. Adepole nurses, sometimes they need to lift the patients for feeding, for cleaning, all those things. So this is like repetitive strain injuries. Because of that repetition of strain, you get injuries, comes under repetitive strain injuries. Pinna violence aham. Violence ellarku ariyunnathaanu. Any injury, any violence by the bystander or by the patient or to the staffs, among staffs, all these comes under common health hazards. Pinna vera oru karyam slip, trip, fall avam. So endengilum vellam floor la slippery surface, so that may lead to slip and trip, subsequently falls. Pinna main aayittulladu sharp injuries. Sharp injuries ellarku ariyunnathaanu needle stick injuries, because many healthcare workers who dealing with the needle, if it is not handled properly, they may tend to develop sharp needle stick injuries. So these are all the common health hazards what a healthcare worker faces. Adepole now in this session we are going to see the common health hazards in different areas. അതിൽ നമ്മൾ ഓരോരോ ഡിപ്പാർട്ട്മെന്റ് ആയിട്ട് നോക്കാം. ആദ്യം operation theater. This is nothing but a OT surgery where the surgery takes place. അപ്പൊ അതിൽ എന്തൊക്കെയാണ് occupational hazards? അതിൽ നോക്കുവാണെങ്കിൽ അനസ്തെറ്റിക് ഗ്യാസസ്, ഈ തിയേറ്ററിനകത്ത് so many anesthetic gases ഉണ്ടാവും. സോ അപ്പൊ അതില് അറ്റൻഡ് ചെയ്യുന്ന ഡോക്ടേഴ്സും nurses-um, technicians-um, they will prone to inhale that anesthetic gases. Because of that, they may tend to develop some illness. Appa idu main aayittulla occupational hazard that is in OT. Pinne adeypole blood-borne pathogens, because when there is a surgery or any procedure is happening, there can be a blood splash. So through which blood-borne pathogens they will come into contact with the people who are working there. So അതുകൊണ്ട് വരുന്ന blood borne pathogens ആവാം. അതേപോലെ they use lot of compressed gases like hydrogen, nitrogen, oxygen, they use there. So compressed gases means a gas which is kept under pressure, high pressure. അപ്പൊ അത് ഓപ്പൺ ചെയ്യുമ്പോൾ ചിലപ്പോ ആ പ്രഷർ കാരണം it will injure the staff who's working there. അതേപോലെ ലേസർ ആവാം. ലേസർ എല്ലാവർക്കും അറിയുന്നതാണ് high frequency light amplification stimulated emission radiation. So you have to take proper precautions, otherwise it will affect the eyes also. Similarly, ergonomic ഞാൻ പറഞ്ഞപ്പോൾ കുറെ ഒരു സർജറി ആയാലോ ഒരു പ്രൊസീജിയർ ആയാലോ മിനിമം ഒരു 2 hours to 7 hours sometimes they have to stand in that particular position. The technicians, the nurses who are attending that surgery, everybody is in a stress. So ergonomic, they have to stand for long hours. Because of that, they may develop back pain or neck pain, all those issues. Pinne OT le nokumbo cuts from sharp objects. OT nu paranja sharp objects they will be using. Sometimes there may happen a cut injury also. Pinne ullathu latex. What is latex? Latex is nothing but a powdery substance. നമ്മൾ ഈ ഗ്ലൗസ് ഒക്കെ കാണുമ്പോൾ ഒരു പൗഡർ പോലത്തെ സബ്സ്റ്റൻസ് ഉണ്ടാവും. That is called latex. So what it does, most of the people are allergic to that. When they wear the gloves, they may develop allergic dermatitis, and sometimes when they inhale, respiratory issues will come. So that is the latex. So ഒരു OT ന് നോക്കുവാണെങ്കിൽ ഇതാണ് occupational hazard. So എന്തൊക്കെയാണ്? anesthetic gases, blood-borne pathogens, compressed gases, lasers, ergonomic issues, cuts from sharp objects, and latex allergy. Okay. Next we will go to lab. What is lab? Lab is a place where they deal with lot of patients with lot of infectious diseases. Appa the person, the lab technician, the staff who's dealing with them should take proper precautions. Otherwise they tend to get the infection from the patients. Adeypole they deal with lot of chemical agents. എന്തൊക്കെയാണ്? formaldehyde, toluene, xylene, the chemical agents they deal with. So they have to take proper precautions. By mistake, if they touch without any proper precautions, they may develop skin allergy, and when they inhale also, respiratory issues can come. അതേപോലെ ergonomic issues ആവാം. ലാബിനകത്ത് കുറേ സമയം നിന്ന് ഒരേ പൊസിഷനിൽ ബ്ലഡ് ഒക്കെ എടുക്കുമ്പോൾ പിന്നെ മൈക്രോസ്കോപ്പ് ഒക്കെ നോക്കുമ്പോൾ ആ ഒരു പൊസിഷൻ ചെയ്യുമ്പോൾ ഒരു സ്ട്രെയിൻ ആവും നെക്കിലെയോ ബാക്കിലെയോ, അത് അങ്ങനത്തെ ഉള്ള ഇഷ്യൂസ് വരാൻ സാധ്യത ഉണ്ട്. പിന്നെ അതേപോലെ സ്ലിപ്പറി സർഫേസ് ഉണ്ടെങ്കിൽ പേഷ്യന്റ് ഓർ സ്റ്റാഫ് ക്യാൻ slip and trip and have a fall as well. Pinna they are dealing with lot of sharps. They withdraw blood with the needles and other things. So sharp injuries, subsequently needle stick injuries can happen. So as a summary, in lab, what are all the hazards? Infectious diseases can happen, can come. You can get it from the patients or bystanders, and it can be through the chemical agents if it is not dealt properly. Pinna ullathu ergonomic and slips, trips, falls, and as well as sharp injuries. Okay. Next we will go to radiology department. So what is radiology department? Radiology department athu X-ray avam, CT, MRI, all those comes under radiology. So what is the main hazard there? Radiation, of course. So radiation is very, very harmful to the people who's working there. So you have to take proper precautions. For example, if you would have gone to X-ray department, the staffs must be wearing a big heavy apron. If you would have noticed, that is called lead apron. What it is worn for? To prevent the absorption of radiation. So similarly, you have to take proper precautions. അതേപോലെ ergonomics, any patient നേരെ RTA road traffic accident കഴിഞ്ഞ് ഡിപ്പാർട്ട്മെന്റിലേക്ക് വരുമ്പോൾ shifting, moving the patient, carrying the patient. So ergonomic related issues can also happen to the staff working in radiology department. Similarly, airborne pathogens are from patient, we don't know, sometimes maybe some cut injuries, if it is not taken care, you may come into contact with pathogens. Either it can be airborne or bloodborne. Similarly, while shifting the patient, transferring the patient, slips, trips, falls can also happen. So these are the main hazards in radiology department. I will repeat once again. It's mainly the radiation, ergonomics, airborne and bloodborne pathogens, slips, trips, falls. പിന്നെ നെക്സ്റ്റ് ഉള്ളത് നമ്മൾ ഫിസിയോതെറപ്പി ഡിപ്പാർട്ട്മെന്റ്. ഫിസിയോതെറപ്പി ഡിപ്പാർട്ട്മെന്റ് നോക്കുവാണെങ്കിൽ, ഫിസിയോതെറപ്പി is a place where we deal with the patients, lifting the patient, moving the patient, making them walk, making them sit, we make them do exercise. So again, the staff who's working in the department may have the ergonomics issues. Okay, back pain varam, neck pain varam, all those things can happen. Similarly, trips while making them stand, while making them walk, sometimes slips and trips. If a heavy patient, you need to lift, sometimes there is a possibility of having a trip and fall. പിന്നെ ഉള്ളത് എക്യുപ്മെന്റ് ഹസാർഡ്സ്. ഫിസിയോതെറപ്പി ആൻഡ് ഈ PMR ഡിപ്പാർട്ട്മെന്റിൽ കുറെ എക്യുപ്മെന്റ്സ് ഉണ്ടാവും. ഇലക്ട്രോതെറപ്പി, എക്സസൈസ് തെറപ്പി എക്യുപ്മെന്റ്. അതിൽ എന്തെങ്കിലും ഫോൾട്ട് ഉണ്ടെങ്കിൽ all the machines has to be calibrated. So biomedical departments has to calibrate all those machines. The output is okay, otherwise it will give shocks and other hazards to the patients and the staff. So equipment hazards ആവാം, അതേപോലെ electrical hazards, fire വരാം, short circuiting, all those things. So these are the health hazards in physiotherapy. I'll repeat once again. It is mainly the ergonomics, trips, falls, equipment and electrical hazards, and fire hazards. We'll go to the next department. Next is the pharmacy. Again, in pharmacy, mainly if you see drug absorption. What is this drug absorption? People who continuously deliver the drugs. Sometimes the chemotherapeutic drugs, they are very powerful, like it gets absorbed through the skin continuously. If you keep on dealing with that drugs, so the staff will get that drug absorption. അതേപോലെ ergonomic issues വരാം, പിന്നെ slips, trips, falls, latex allergy. So all these things in the pharmacy. Next we'll see the central supply department. So what is this department? What is this department as? They are the department who supply the sterile equipments to the OT and other small procedures where it is happening. So they collect the equipments, they clean, they sterilize, they put it in pack, and then they send it to the concerned OT and wards and where the procedures are happening. About what is the hazard in that department. So in order to provide cleaning, sterilization, all these things, they also deal with lot of compressed gases. Again, ETO. What is this ETO? Ethylene, what is that? ETO, one second. Suprita. Next slide. കട്ടായതാ. ഹലോ, Is it audible? It's okay. Yeah, I think they raised. It's a charger.
Hi all, is it audible?
Yeah. Okay. Sorry for the inconvenience. Okay, so I'll continue with the session again. So coming back to the central supply department, so as I told you, mainly the compressed gases they deal with for the purpose of sterilization. So people who are working there, they get exposed to, they inhale sometimes these things, and while dealing also they may get into injury, like, it's because of the high pressure inside the gases. Then this ETO sterilization, ethylene oxide sterilization. So this is like a very, very highly poisonous gas, but the advantage is like you get 100% sterilization. Even the small DNA of the organisms will be killed. Adana ETO sterilization. The problem is the gas itself is highly poisonous. Even after the sterilization, you're not supposed to go near that. You have to wait maybe like 24 hours or 36 hours. Then only you have to go near that. So the staff who are working in that department sometimes have the possibility to get exposed to this ethylene oxide gas. Again, coming back to sterilizers and cleaners, they also deal with lot of chemical agents to sterilize those equipments. So again, these agents has to be dealt very carefully. If they don't take care, again it is a hazard inside the department who are all working there. Again, ergonomic issues, as I told you, they have to sterilize, they have to pack it, and then they have to send it across. So ergonomic issues. Again, burns and cuts due to steam sterilizer. Sometimes they use steam for sterilization purpose. They have to take care. Otherwise, it will result in burns and cuts. So these are all the health hazards in central supply CSSD department, central supply department. So what are all those? Compressed gases, ETO gas sterilization, chemical agents, ergonomic, burns and cuts. So we'll go to the next department. Next department is the laundry. So what are all the health hazards in laundry? Laundry is a place where they clean the soiled linens, sheets and everything. So all those contaminated laundry, the workers has to come into contact with that. So all has to take proper precautions. That laundry lo ubhayogikkunna washing machine angle, it is like 52 kilos. That capacity what we use only it's 5 kilos or 6 kilos. So imagine the capacity of the washing machine. So obviously noise varum, adu porthekku heat emission avum. So all those people avada work cheyna aalkaru idilukku expose avum. Noise pollution, what noise pollution will cause? Continuous noise pollution will make you feel deaf. Appo adepole heat stroke varam. All those hazards can happen in the laundry. Then coming to the same in the department, if you see lifting, again what is this lifting? Lot of things will be coming, washing, then after that ironing, they have to pack it, they have to send it to the concerned department. So for lifting, pushing, moving, all those things, ergonomic issues also. Sometimes what happens in laundry, that linen will be having some hidden sharps when it is segregating. While they are segregating, if that sharp is not taken care, they may get into needle stick injury as well. The slip strips falls, because washing, all those things happening, slippery surface undavam, സൂക്ഷിച്ചില്ലെങ്കിൽ സ്ലിപ്സും ട്രിപ്സും അതിനുകൊണ്ട് ഫാൾസും വരാം. പിന്നെ ഉള്ളത് അതേപോലെ heavy huge noise and heat emission is happening. So there is a possibility of fire hazard also. So these are all the main health hazards in laundry. So if you see in laundry department, what are all the health hazard? I repeat, it's mainly the contaminated laundry, then noise pollution, heat pollution, then lifting problem, ergonomic issues, sharps injuries, slips, trips, falls, and fire hazard. Next, we'll go to housekeeping department. So what are all the main hazards in housekeeping department? So what does they do, housekeeping department? They are the one who's cleaning the entire area. So they are definitely, they'll be coming into contact with chemical agents, lot of solutions, pesticides, all those things. So they have to take care of themselves, and sometimes they should not inhale also, wear a proper mask, wear a proper gloves when coming into contact with that. And similarly, contaminated objects, sometimes contaminated with urine, contaminated with the vomiters, all those stuffs, sometimes they have to clean that. So proper precaution should be taken. Again, infectious agents they will come into contact with. Again, latex allergy, latex is a powdery substance, so adana allergy varam. Similarly, when they sort out the waste, so sharps can prick, so needle stick injury again. Again, lifting, moving hazards, slips, trips, falls. So all are these are the things in housekeeping department. Next, we'll go to dietary department. So dietary, again, it is a department where they cook food in large quantities, and then they send it to the floors and to the patients, bystanders, everywhere. So what are all the hazards in the dietary? If you see in the dietary, again, cooking means heat evolution will be there. So heat will be there. So the workers who are working inside the dietary will be exposed to this. Similarly, moving machinery, sometimes if you have to move heavy machines with the cooking utensils, all those things. And again, fire hazard can happen, slips, trips, falls, electrical equipment hazard. So these are the main things in dietary. So now you have seen all the departments, see, like starting from physiotherapy, CSST, OT, then lab, then what else, radiology. You have seen all department wise. Okay, so these are all department specific hazards. Everyone should be knowing. Now we'll see the general hazards. What are all the general hazards? So it is not necessary it is to department pertaining. It can happen anywhere. So any department, any place. So you should be aware of the general hazards. Coming under that is the bloodborne pathogens, hazardous chemicals, latex allergy avam, electrical injuries, anywhere fire or short circuiting can happen. Similarly, slips, trips, falls. So idakka common general hazards you should be knowing. This is not department pertaining. It can happen anywhere. Among those bloodborne pathogens, hepatitis B, C, HIV, these are all the main bloodborne pathogens. Hazardous chemicals coming under that is pesticides avam, disinfectants avam, some hazardous drugs what we keep in the workplace. Idakkeyaanu hazardous chemicals la varanada. Pinna ullathu naan paranjathu latex aanu. Latex, as I told you, gloves la undavam, chela flexible tubing la undavam. Sometimes allergic hypersensitivity, dermatitis, respiratory, which I have told you already. All types of healthcare workers are prone for latex allergy. Electrical injuries, as I told you, electrocutions, fire, if worn out cord somewhere, if it is there. So short circuiting varam, fire hazards varam, all those things. Slips, trips, falls, sometimes wet floors, slippery surface, all the possibility of injuries can happen. So again, main thing is also stress in workplace can also be a general hazard. So you might be wondering how stress in workplace can be a hazard. It is a main hazard because if you are under stress, the productivity is reduced. So we will just have a quick look at this. What is the reason and what are the effects and what are all the solution also to reduce that. So it is, I'm talking about the stress in workplace. So many people will be, or not many, all of us are having even stress at work also. So, but here I will concentrate on the stress in workplace and how it is an occupational hazard. It is coming as a occupational hazard. So the reason for stress in workplace. So what could be the reasons? Sometimes you are dealing with lot of patients with the life threatening illnesses and injuries. Now we are facing this COVID situation, so all these things, and again before there was Nipah, so all these things, so these are the sometimes when you continuously have to see such patients, you may be having some stress which will pile up, and it will become a big problem. So, and sometimes can be understaffing in your department. ആൾക്കാർ ഇപ്പൊ ഈ ഒരു 7 ആൾക്കാരുള്ള സ്ഥലത്ത് only 4 പേരെ ഉണ്ടെങ്കിൽ, so you might be overloaded and you will have to work overtime and extra work, so it will also put you stress. Similarly, malfunctioned equipment, so equipment ചിലപ്പോ നമുക്ക് ആവശ്യത്തിന് ഉപയോഗം ഇല്ലാതെ അത് എന്തെങ്കിലും പ്രശ്നം ഉണ്ടാവാം. ഫോർ എക്സാമ്പിൾ, നമുക്കൊരു ഓക്സിജൻ സിലിണ്ടറിന്റെ ആവശ്യമുണ്ട്, പക്ഷെ അതിന്റെ വാൽവ് ഇറ്റ്സ് നോട്ട് വർക്കിംഗ്, so but you need that immediately. So sometimes that kind of malfunctioning equipment, sudden patient death, you are dealing with the patient for a long time, അപ്പൊ പെട്ടെന്ന് അത് ഡെത്ത് ആവുമ്പോൾ അതും സ്ട്രെസ് വരാൻ ചാൻസസ് ഉണ്ട്. പിന്നെ ഉള്ളത് ഹയറാർക്കി ഓഫ് അതോറിറ്റി ചാലഞ്ചസ്. വാട്ട് ഇസ് ദിസ്? സംടൈംസ് വി ഹാവ് സം ഇഷ്യൂസ്, നമുക്ക് അത് നേരിട്ട് സോൾവ് ചെയ്യാൻ പറ്റൂല, സോ വി ഹാവ് ടു ഫോളോ ദി hierarchy. We have to tell to your senior, and then you have to tell to the immediate manager, then line manager, then comes the top man, like that. So hierarchy of authority we call it as. By the time it takes some time, so by the time it reaches, maybe your problem is getting solved also, we don't know. So that also put a stress in you. And again, coming to the next point is demanding patients. Chala patients, they are keep on demanding, so they're unsatisfied, so how much ever you do, that will also put you stress and continuous strain. And similarly, demanding boss also, your immediate manager may be putting I mean time limit for this, you have to do this many patients, you have to do this much of work, and there is a period which you have to cover up. So all those things, again, unable to meet the demand. So demand versus supply, so you cannot able to manage the demand like that. Again, similarly, excessive paperwork, lot of paperwork has to be done. So all these things will put the healthcare worker under stress in the workplace. So they are also giving the effects of stress. So what will happen if you are under stress, continuous stress? So these are the some symptoms which you may feel, like loss of appetite, mental disorder, mental agony, migraines, difficulty in sleeping, emotionally you will become unstable. So what will happen? There will be a disruption of social and family life, stress, and finally it will affect the attitudes and behavior, and at the end of the day you will be burned out. So in order to avoid all these things, there is also some solution. Please have a look at this. So you have to define the aggravating factors, list it down. നമുക്ക് ഏതൊക്കെയാണ് ഇന്ന് എന്തൊക്കെ ചെയ്തു, so what are all the things I did from morning till evening, so what could be done tomorrow to avoid this kind of stress. Maybe like you have to reschedule the order of the list of things you are doing. So in that way, if you feel it is comfortable, you can continue. Similarly, you should have some discussion or support groups. You can go and ask them, they will give you a solution, do like this, do like that, so you get some ideas adu engane proceed cheyanulla idea. പിന്നെ ഉള്ളത് changing the work design, the pattern of the work. Each one is having a pattern of work design. So ഒരു ദിവസം നമുക്ക് മാറ്റി ചെയ്ത് നോക്കിയാൽ ചിലപ്പോൾ അത് സ്ട്രെസ് റെഡ്യൂസ് ആവാൻ റീസൺ ആയിരിക്കും. അതേപോലെ ഇൻവോൾവ് എംപ്ലോയി അസിസ്റ്റന്റ് പേഴ്സൺ, ദാറ്റ് മീൻസ് ആവശ്യമുള്ള വരുമ്പോൾ you need to call some of your colleagues, some of your assistants to make use of that, take the help from them. That is the involving employee assistance personnel. അതേപോലെ you should have a mentoring relationship with all your colleagues, friends and job place workers. അതേപോലെ collegiality you have to maintain. You should have always have the habit of having gift of encouragement, again self-esteem, motivation, positive attitude. All these things will reduce your stress, and this will help you going into stress related depression or anxiety. So you have to have a solution to reduce your stress. So coming back to the general measures. So I told you department pertaining, each individual has its own occupational hazards. Adu koodade thanne general hazards we have seen in which is happening everywhere. Now we'll come to the measures. So what are all the measures? How to take care of the occupational hazards. So continuous monitoring is being done here, and continuous training is being given to the patients. And ആവശ്യത്തിന് നിങ്ങൾ PPE കിട്ട് ഏതാ ടൈമിൽ വേണമെന്നുള്ളത് നോക്കിയിട്ട് you have to make use of that. So and again there is a eye wash station is kept at the relevant departments. Any eye splash, any blood splash, body fluid splash is happening, so immediately it has to be washed. So that is like eye wash station. All these things are the general measures. Again, a prevention, how to prevent. Always prevention is better than cure. So you have to prevent, take care, I mean you have to stay safe. Again, how to prevent infection anengil you can go for immunization. So ellarku ariyunnadanu recommended immunoprophylaxis. There are immunization available for all these kind of hepatitis B, MMR, meningococcus, influenza, hepatitis A, varicella, tetanus. All these things immunization is available, so you have to make use of that. Again, how to prevent physical injuries. Noise pollution, how to prevent noise pollution. So you have to use earplugs, so that will help you prevent the ear becoming deaf. So earplug illengil, what you have to do, some simple roll of cotton if you put also, it will help you. അതേപോലെ machines guards are available. Hot equipments which are very difficult to touch. What is that? Dietary machinery ka na parnilla, moving machineries, very hot surfaces to touch, all those appo avadekka guards vechuvaanengil we can prevent the physical injuries. Adepole sharps na we have to use a proper sharp container only. Adepole wet surfaces kaanvaanengil appathane immediately if you dry it, then you can avoid the slip strips falls. So these are all preventing the physical injuries. Adepole hand washing techniques, everybody is doing already this one. So this is the best way to prevent the spread of infection from patient to patient. Immediately you have to hand wash either with the soap and water or the hand rub. How to prevent the ergonomic injuries. So there is a proper lifting techniques we use to lift the patient anengilum, other equipments anengilum, maintenance workers sometimes they need to lift some objects, moving the AC, shifting, lifting. So they have to use the proper lifting techniques so that they don't get hurt in their backs. You can always ask for a healthcare worker, okay, to help you, help employing the healthcare personnel for helps. Again, lifting assist devices can be used. People who work for long hours in one position, prolonged sitting, prolonged standing, they can even change the position so that they can get rid of the ergonomic issues. So some ergonomic posture I have shown you here. So how to stand, if you see this slide, the middle picture is the person who's standing with a good posture. If you draw a line through his ears, that line should pass through the shoulders, knee, and through the ankle. So if there is a poor posture, if his head is moved either forwards or backwards, similarly the knee protruding forwards or backwards, that shows it is a poor posture. Again, sitting also, the back should be kept at 90 degrees. Excessive slouch or excessive moving forwards should be avoided. So these are all some techniques, tips to take care of the back. Again, principles of lifting, how to lift a patient. For example, a single patient with a single healthcare professional. So its best way is to stand in front of the patient, waist you have to hold your hands, and then you have to lock his knees with your knees, and then you can carry him. Similarly, rendu people undengil, one person behind the patient, one person in front of the patient. So the person who's standing behind can hold the patient underneath the axilla of the patient. The other person can hold both knees together. So that is how you have to lift and shift. then everybody must be knowing the sheet carrying method. That is the very easiest and safest method. Okay. Again, as I told you, principles of lifting any heavy objects, there is a way to lift. Simple thing, it's like a tip. So you, whenever you want to bend and lift something, never bend from your back. So you should always keep your back straight, and then you have to go close to the weight, bend your knees, and then carry. First of all, if it is a heavy weight, you have to divide that weight. For example, 15 kilos ulla oru weight undu. So divide as much as possible, 5 plus 5 plus 5. So then you can carry. Avoid carrying or lifting heavy weights. And if it is you divided already, then this is the technique. Go close to the weight, bend your knees, keep the back straight, and then you get that weight close to your body, then you can lift it. Idu patient ayalum cheriya kuttigal ayalum, this is the way you have to lift. So so this is the all about today's session, occupational hazards. Hope you enjoyed the session. There is no doubt. If any doubt, you can ask me. Thank you all. Is there any queries, any doubts I can answer?
CV though.
Any questions they want, they can ask me.
So I'll finish it and say thank you.
So thank you all. It's done. Any queries, any doubts, you can get back to me through Ms. Suprita. Thank you.